I've been practicing, I don't know, for 20 some odd years. And first few years I drilled holes in people's heads, and then somebody asked me if oregano and rosemary were good to use in their mouth, and I had no idea. So I realized that I had to learn stuff, and that kind of led me on a path. And Susan was great. She kind of helped point me in the right direction and directions. And then somebody gave me an ozone machine. I started using that and figured out how to use it, took everybody's courses. So that's kind of my journey. And now I think I'm more on the regenerative. Instead of drilling holes in people's heads and amputating stuff, I really want to start regenerating stuff and using biologics and peptides and ozone to kind of recreate structures. So.
Exosomes and peptides.
Yeah, it's all good.
So, Eric, I call him Mr. Ozone. He knows pretty much everything there is to know about ozone. But he knows so much. This man is brilliant.
Okay.
So my journey was, I did dentistry for probably 10 years. And then I had 3 kids in 3 years, and I didn't do dentistry for about 8 years. And when I went back into dentistry, I was just like, oh no, this is not it. And so I started an integrative health program at California Institute of Integral Studies. I was in the first class of integrative health. But I had 3 little kids, I worked, and I was writing a bunch of papers. And I realized all my classmates went to holistic dentists. And I'm like, what's that? So then I started my journey by going and visiting all the holistic dentists that I could find. And I think the thing why it's so great to have Eric here is that there is no training for being holistic. You just kind of figure it out, you put it together, and all the holistic dentists are really kind. They share. They share information, and most of them are double degreed, so they might be chiropractor DDS, homeopath DDS, acupuncturist DDS, massage therapist DDS, so they're all like energy worker DDS. They all kind of just gravitate to the way they like to put it together. And so I have learned just from hanging out with people, talking to them. And when I moved up here from San Francisco, I met Eric and Brian Smith in the first 2 months, and I went, okay, I'm done. I found everyone I need. And so I don't own my own practice anymore. I sold it when I had kids, and now I just work in other people's practice, and I beat you. I've been doing this 35 years. And for the last probably 15 years, I haven't done the actual dentistry anymore. Now I just do energy work, and I be with the people, and I do a lot of the gum work. So, yeah, and the way I got involved in Weston Price was, I was back with Nourishing Traditions a long time ago, and Julie Matthews, I don't know if any of you know her, she's a certified nutritional consultant. She specializes in autism, and we used to go together to parents groups and schools, and we used to talk about Weston Price and educate people, and she would do the nutrition, and I do the dental, and we just had a lot of fun. So that was that.
Yeah. Susan's done a lot of work, and she's reached out to a lot of people, which I think is amazing, and I'm just really amazed that you put all that work into it. I think for our discussion tonight, one of the big things, like Susan said, is that, like, what's the definition of holistic dentistry? And so I think that's pretty confusing to the consumer at large. Is now there's a delineation between traditional dentistry and holistic dentistry, and what really is holistic dentistry. And like Susan said, it's just everybody has almost their own definition of it, and there's so many facets to it. There's so many parts and pieces and modalities that you can include into a moniker of holistic dentistry that I don't think that we could give you one exact definition of it. But I think one of the main tenets is that it's an alternative way of thinking. And
it's not a green dentist. I want to make that distinction. People that say they're green dentists, they're talking about disposables and how they've certified green, and it has nothing to do with being holistic.
Recycled tires for carpet. I love it. It's like unclear on the concept.
Yeah.
So, yeah, there's always been these kind of movements. 15 years ago it was all about cosmetic dentistry. If you place white fillings, you were a cosmetic dentist. And like Susan said, the green dentistry, that kind of fizzled out. It took off, and then it fizzled out for a while.
Yeah.
But I think the moniker of holistic or integrative or natural or biologic, I think that will take hold. I think eventually, because I think as consumers we want a lot more from dentistry than we've been given in the past. We've been given the shot and the drill, drill a hole in your head and scrape really hard and fill up the hole. It doesn't work. I mean, you guys know that just as well as we do. You've been to the dentist enough times that, all we're doing as dentists is fixing old dentistry, which is a really stupid business model to do, and it's stupid for the patients. It's like, okay, well, that crown that was in there, now it's breaking down. It's like, that's silly. Why did we put the crown in the first place? Why didn't we just try and save the tooth or regenerate part of the tooth?
So there is no good dental materials, just so you know. Nothing in dentistry
everything's toxic. Everything's toxic in dentistry.
It's just like, what can your body tolerate?
Yeah, what's the least toxic to the body?
Yeah, but they're all the materials are toxic. So you never ask, is this a good material? Because if you ask your body with muscle testing, it'll say no for everything. So you want to just say, well, what can you tolerate? What works in your mouth? Yeah.
I had one mom who brought her 8-year-old son in, and he had a cavity in one of his baby teeth. And so I drilled the cavity out, and then she said, wait a minute, because she was really, really knowledgeable, and she had done her research. She goes, do we have to fill it with a filling material? And my little dentist mind is like, of course, lady. I just drill holes in people's heads and I fill it up. What do you think? And then I thought for a second to myself, I obviously didn't say that, but I thought for a second, like, okay, well, if we put ozone in it, and she takes the ozone oil home and she cleans all the scrambled eggs out of the hole, and the cavity doesn't get worse, then we've won. Then they get their permanent tooth healthy. And so what if the baby tooth has a hole in it? Big deal. So I think it's just a different way of thinking. And I think dentists were trained a certain way, and we just need to, as dentists, need to think of it in a different aspect. And I think we need to come at it from the patient side of view. How can we make the patient more comfortable? And what things can we do that, like Susan says, is make things more tolerable for the patients.
And not only that, but really, I think the bottom line, and Eric and I had this conversation before we came, is what can you all do to make things healthier without us? Like, how do you benefit from what's available and the information so that you don't need to go to the dentist? We were not designed to have to brush and floss. That happened when we brought in agriculture and people started getting decay. So our body doesn't need that, but how do you bring your body up to a level where you're more alkaline and you know what you should or shouldn't do? And I think that's kind of the part of the conversation that I wanted to have, is what things do we have available that would benefit you so that you don't get decay, you don't get gum disease? And how do you know? Because you all have the ability to see. Your tongue is a good sleuth. It can check around in your mouth, it can find things, but if you never look, because most of us take our brush, put it in our mouth, and then we're gone, right? We go into a rote, we just don't even think about what we're doing. And your lips, your cheeks, and your tongue, they're active and they have their way with you, and they'll push your brush out and they'll do this and they'll do that. And you don't even know if you're breathing well. And we have such a big problem with airway now.
Susan's right too, is that, I can't tell you how many times the patient will come in and say, well, I brush and I don't really floss as much as I should. And so it goes, and what we're trying to tell you is it goes far beyond that. There's so many things out there now, so many tools that we have as a consumer to be able to take care of our mouths at home and to really make a huge difference in terms of how our oral health goes on in the future.
You want to talk about that?
Go ahead.
All right, so there are lots and lots now of saliva tests that you can do.
So let me preface this for a sec.
Yes.
So we, as humans, we have about 100 to 125 different species of bacteria in our mouths. Most of them are pretty good. There's a couple, probably under 10, that are bad players. And so the whole idea of what we're trying to get across is that we need to get the good people, good bugs, to influence the bad and overtake them and have a good overall influence. Right.
We're not trying to kill them all. We're not trying to take mouthwash, which is a really bad idea, and totally destroy the oral microbiome. So ozone is one really
We're trying to make the biome more healthy, in other words.
Right.
Yeah.
So this particular test, because I just talked to the guy yesterday, because you can do a spit test, and this particular, it's called bristle. Then they'll give you they'll look at 700 different bacteria in your mouth. And by the way, he told me there was 6 billion bacteria in your mouth. And I went, yeah, that's a lot. And some of the bacteria are more for cavities. They attack your teeth, and others are for inflammation, which cause your gums to bleed. So there's different players. And once they give you the results, they also will give you some options of what can you do. And so I went through all of them with him, and some of them are...
Wow.
I
wow,
did.
Very cool.
It was very cool. So one of them is you can use, which is pretty new, which is those microcrystalline hydroxyapatite toothpastes. Do anybody of you know about that? Well, so your enamel is made of hydroxyapatite, and these toothpastes put hydroxyapatite in a nanoparticle into the toothpaste.
So every 2 to 3 hours, the top layer of our enamel dissolves and then it reforms. So if our enamel is 2 millimeters thick, the top 5 microns, so it's a small percentage of it, but that dissolves and then it reforms. And so if we can get a material in there that helps the tooth reform the way it should, then we've won.
What's
so
it called again? Could you say that again? How often?
2 to 3 hours. So it's 2 hours of dissolving and then 2 or 3 hours of reforming.
And it's micro...
And so what...
Microcrystalline hydroxyapatite.
Basically, hydroxyapatite is what the teeth and bone are made of.
So I'll pass this around. This is the newest one that I found.
So Dr. Jen she thinks her toothpaste is better because it has 10 milligrams of hydroxyapatite
10%.
versus 10% versus everybody else that only has 2%. So that's the controversy in the hydroxyapatite world.
Right. So she's like, this is the minimum amount you need for it to be effective, and all those other ones are crap.
And she doesn't get her hydroxyapatite from China either. So.
Right. China. From corn.
That's right.
Or whatever.
She's pure.
So that's one. You're trying to remineralize your teeth.
And that's what people talk about when they talk about remineralizing. We're not saying that if you had a really big hole in your tooth, we're gonna shrink it into a small hole. It's just we're talking about that layer, that intact layer of tooth structure
To make it more impervious.
Right.
And yeah, it can't refill a hole. Sorry.
Yeah.
We haven't seen that yet. Maybe you all can figure that out at some point and let us know.
But cavities form when the bacteria poops on the tooth. So if we have a really strong enamel layer there with hydroxyapatite, then even if the bacteria poops, then it's not going to cause cavities.
Right. And so the pH in your mouth makes a big difference.
Bacteria really like acidic environments.
So 5.5 is cavities.
Right. So remember the pH scale from high school chemistry is 7's in the middle, 0 to 14. Our blood is about 7.35, and there's no way that our mouth could ever get to that pH. So our mouth is anywhere in the 5 to 6 range. Most people are at a 6.0, 6.2 range. Cavities start at 5.5 and below, so more acidic. Gum disease starts around 6.2 and then lower. So if we can get our pH to about 6.8, that's probably ideal.
So using that remineralization is one option.
If we go to the drugstore and get some pH paper, some litmus paper, and then just take your pH when you get up in the morning, and then do it for 3 or 4 days and then average it.
So you're talking about body pH, not mouth pH.
No, mouth pH. We're talking about mouth pH.
Okay.
We
Just
don't,
say that again.
we don't care about the rest of the body because we're just dentists. We're not real doctors. So, yeah.
We're not peeing on the litmus
maybe
paper.
body pH might affect your mouth pH or something.
Well, it does. It does, but we're just really concerned about the oral pH.
And so to get a strip to put into your mouth and check your mouth pH.
Yeah, just spit on it.
Yeah,
that's
okay.
fine.
It's just really, you've got to measure it quickly because it starts changing quite rapidly.
So confusing. Confused already.
She was wondering the same thing, so.
That's fine, no problem.
No pee involved.
So anyway, the remineralization is an alternative to fluoride, just so you know. We are not advocates for fluoride. Fluoride is an enzyme inhibitor. It changes your brain IQ. It causes ADHD. It's cumulative.
The original idea behind fluoride, or what they proposed, the original idea was, is that if during that remin and demin cycle of our teeth, if we got fluoride into the hydroxyapatite, it would be a stronger hydroxyapatite. That was the original argument. Well, the fluoride that they put into the water was just a byproduct of the aluminum industry, and they couldn't dump it into the river, so they put it in the drinking water. But they never, the only studies they did around the Three Rivers area back in Ohio and Pennsylvania was that the over a year's period of time, the cavity rate went down for that population. So when they go buy new toothbrushes or what, there was no parameters on that. There was just fluoride dumped into the water. But you're right, fluoride is a neurotoxin. We could have been somebody because our IQs would have been higher if we didn't have that. But it also crystallizes the pineal gland, and
It
so
does.
how many people have sleep issues?
I have a pineal gland that's calcified.
Oh.
Thank you for my fluoride in the
It binds to the iodine receptors on the thyroid. So how many people have thyroid issues? So it's just toxic systemically. So
But you can mitigate, so don't
Just
think
don't use
it's
it. Yeah, that's all.
But don't
That's
add to
mitigated.
the burden.
Yeah.
There's enough body burden around.
So if we grew up,
Yeah. Oh yeah. That you hold that.
The-
Hold that thought.
Yeah, with the stuff that we ingested as kids, can't really do anything about it now. But,
well, you can
yeah.
eliminate stuff.
Yeah, now we can
you
start
can
to
detox.
yeah, we can change things the way they are now.
So another thing you can do is xylitol gum, which is a sugar alcohol, which you can chew, and it kind of makes an oil slick, so the bacteria think they have food there, but they can't really eat it. So the
And
bacteria
they die.
die.
They die.
They explode. No. So yeah, but the problem with xylitol, a couple of problems. One is some people make it from corn, which is from China, so it's not a good source. Other ones make it from birch bark, which is what it's supposed to be. It's okay in your mouth, not great in your gut, so you don't really want to cook with xylitol because it affects the bacteria in your gut, and there's this connection 20 seconds between the mouth and the gut.
That's amazing that it's connected.
And so, I have this one. You probably don't know about this one. This is really cool. This is called Basic Bite Chews. They are.
Arginine.
Yeah, you did know. You're so smart. I knew you would know. Anyway, it's cool because
Why is it cool?
because it prevents the biofilm and it neutralizes the bacteria in your mouth, the sugar acids. It nourishes the beneficial pH raising bacteria, and it's an amino acid.
What are you talking about?
I'm talking about arginine. I'm talking about
It's a product. It's a product
something
called they're Basic Bites. So
It's
the product,
Basic Bites.
the brand name is Basic Bites.
Uh-huh.
They're little squares. And
chocolate
they're
creams, chews.
They're flavored, and then you just chew them, and they have arginine in them, and so they're doing all the things that Susan's talking about.
Okay.
So they're another way to neutralize, benefit your oral environment.
Oh, okay.
And that was a new one for me.
Awesome.
I didn't know
Awesome.
about it.
Cool.
Have you tried
And
them?
yeah, I love them. And arginine also is a precursor to nitric oxide. So nitric oxide helps your circulation. So
Oh yeah, so we
I
can
thought
go
that made you high.
nitric oxide. No, you're thinking of
no,
nitrous
oxide
The
is
balloon.
stuff. So
That's the stuff that you breathe.
that'd be
This
awesome.
is also called nitric oxide, NO.
NO. Yes.
But the other part of
That
the
helps your
NO
circulation.
is
But-
that you should eat foods rich in nitrate, because like beets and greens, because those convert to nitric oxide and to
Slowly.
hydrogen peroxide.
Yeah. Slowly.
Yeah,
beets and
in your saliva.
Yeah. Kale. Just
Greens.
green veggies.
Green leafy greens.
Dark veggies. And then, so hydrogen peroxide is oxidate. So anytime you have oxidative therapies in the body, oxygen, ozone, hydrogen peroxide, that's all going to help be more healthful. So
And then you can also take oral probiotics, and
Yes.
this
There's-
company has their own, but they say you
there's
can.
probably five or six different companies now that
There's
have
a
oral
ton of them.
probiotics.
I think I brought one.
So, and that's speaking to trying to change the oral biome to a
Yeah.
more healthy one.
It's
So
it's trying to overwhelm the negative bacteria. They're
Yeah.
called pathogenic bacteria, the ones that aren't great, and you're trying to change it to the commensurate bacteria, which are the positive.
well, if we classify them all like red, orange, yellow, green,
Yeah.
the green ones are the good ones, the red ones are the bad ones, and yellow and orange are in between. But if we can kind of try and convert everybody to green, then that's really the ticket. That Brussels company is one. There's a
There's a
couple.
bunch,
There's
yeah.
there's a couple other ones that they can you can take a saliva swab, or you can
You can put a little probe in.
Yeah, you can do a
This
bunch
one
of
is just spit.
yeah, a bunch of different things that will determine your oral bacteria. I have a friend who's working on an app that's you just talk into your iPhone and it will tell you your bacterial species. So
That's the
that'd
next
be really
evolution. Very cool.
cool. And I think that's where we need to go too, is because that's real time. It's something where we can talk into it 1 minute, we can brush our teeth or do all these other things in our mouth, and then talk into it again and then see if it's
You can compare and you can see, well, how did that work? Did that raise my blood glucose level? Do you know what I mean? People are always testing.
It will also give blood values, and it would help us as practitioners too. If the patient were to talk into it, then we did our treatments, then they could talk into it again and we could see real-time effects.
And Brian said he really likes this as another option, which is, you know this one? It's a non-acidic absorbable vitamin C.
Okay, so nobody should be taking ascorbic acid. Just throw the ascorbic acid in the garbage. It's a sugar molecule. It does nothing. It's not vitamin C. Sodium ascorbate is vitamin C. Rose hips, anything else, comma. It's all,
You wanna
that's
pass it
all
around?
real vitamin C. So
and you
ascorbic
can
acid,
rub it on your gums.
yeah, you can do a lot of things with it.
It won't make you have diarrhea.
Right. Ascorbic acid drives your ferritin levels up. Ferritin is a disease driver, so basically ferritin is your iron carrier in your body. And we have
Could you say that again?
ferritin, Ferritin,
So
is the
this-
iron carrier.
And
So nobody,
it dries up your ferritin
it
level?
drives disease.
Drives.
up
So the higher your
ferritin
ferritin
level.
level is, the more disease susceptible you are. Nobody is really iron deficient. Nobody's anemic. We don't have a lack of iron. It's other stuff. We have lack of copper, maybe selenium, magnesium, all that stuff, but
Could
not
you see
iron.
the toothpaste again, please?
Right.
Sure.
Yeah.
Pass it back.
Um,
You can pass this around too if you want to see the Bristol test. I haven't done it yet.
did that make sense about the ferritin?
It does make sense. I do
Yeah.
actually understand that about the ferritin, but I was surprised that something that you put in your mouth drives up the ferritin levels.
Ascorbic acid drives up ferritin levels.
You know
So
what we called
that's-
vitamin C? Take your
Yeah,
vitamin
that's
C.
typically-
That one
all
is not great.
all the IV vitamin C's in this country are all ascorbic acid. They're all ascorbic acid based. So all the the energy, those little vitamin C tablets, pills, emergency, that's all ascorbic acid. So I'm just saying that ascorbic acid will drive up your ferritin levels, whereas sodium ascorbate, rose hips, any other type of vitamin C variety will not.
I have a question.
Interesting. That's great.
What do you do if you breathe the ozone? What do you counter it with? That?
Um,
Because I use emergency.
So, yeah.
What's the problem with driving up your ferritin levels again?
So ferritin, the problem with driving your ferritin levels up is that it will reduce your immune system or your body's ability to fight disease. So if it's above 50, really it should be below 30, but if it's above 50, you're more susceptible to disease your immune system is compromised. Susan,
nobody knows this.
Susan asked, if we're
The other thing that we didn't introduce yet is to help your mouth is to use ozone as a gas. And you can run along the gum line because just under the gum line, that's where all the anaerobic bacteria live. And
those are the bad guys.
they're the red guys.
The red guys.
So I said, well, you can't breathe ozone, so you have to run suction with it. But if someone were to breathe it, which someone with a cold or a stuffed nose breathes in, they can start coughing. And so you have to remedy that because they're not going to be very happy.
That went back to the vitamin C question.
Yeah.
So vitamin C is an antioxidant, ozone's an oxidant.
So they can counter each
the
other.
reason we use ozone in dentistry is because it kills bugs. So it will kill any pathogen out there. So it will kill bacteria, fungi, viruses.
And
So-
parasites.
And parasites. Anything that's pathogenic or that's delirious to us as humans, it will kill or inactivate. And so in the mouth, mostly we've been talking about bacteria. Sometimes there's fungi, sometimes there's viruses, but for the most part, it's bacterial-mediated diseases in the mouth. So with ozone, now we can reduce that pathogen load or that bacterial load in the mouth and then reduce dental problems going forward. If we typically use ozone gas, sometimes we'll bubble the gas through oils and have ozonated oils, sometimes we'll bubble it through the water. and we can rinse people's mouths out with ozonated water.
Sidebar.
If you
Eric makes everything ozone that you could ever want.
Thanks.
Toothpaste,
that.
deodorant, save it. Okay.
So if you breathe the gas, it's like being outside on a smoggy day. That's your windpipe gets irritated. If you breathe the gas as we're applying it to your mouth, you can cough. And so the way to reverse that cough is to take vitamin C because it's an antioxidant. I don't think that I've done it 4 times in the 15 years I've been using ozone, and every time was when I wasn't paying attention. Like somebody walked away with a suction or something happened. There should be I teach other dental offices how to do it, and there should be no reason why anybody should cough with ozone applications if we're paying attention.
I've had one person.
Yeah.
But a lot of people just like little kids or whatever. But I just wanted to know, would that be a better antidote?
I just think that we don't even need an antidote because we shouldn't be making them cough.
Yeah, but what if they do?
And I think that it was horrible when I made the 5-year-old cough because her mom thought that I killed her. So,
wasn't happy. So I would like to talk about the ozone, but I am also going to talk about this Juice Plus.
Okay.
This is another.
She has a whole bunch of stuff. It's a big bag.
No, I'm just going to talk about this briefly, but Juice Plus is a product that's been around for like 25 years. I used to use it when my kids were little, and then we stopped. It's just concentrated fruits and vegetables. They have omega-3s now.
Wow.
And it's super, super clean. But since those 25 years, when I used to give it to my kids, they've done a lot of studies. So they have actual studies that it helps with, if you have tooth extractions, it helps with the bone healing. If you have bleeding gums, I've had 2 patients now that have been on it and their gums have stopped bleeding.
Cool.
Pretty cool.
That's cool.
So anyway, this is another option. And the nice thing about what I like what they're doing is if you were the parent and you decided you're going to enroll in this and get these and take them, they will give a child from the age of 4 till 26 free for that whole period of time. You just can sponsor your own kid or someone else's kid, which I think is really awesome.
Wow.
What,
That's
how does
cool.
that say it again?
So if say I bought Juice Plus, I'm taking it. But now because I'm taking it, I can offer for a child between the age of 4 all the way through till they're 26, they'll get free Juice Plus. These are capsules, but for littler kids they have chews. And so I'm sponsoring one of our staff's kids.
Sweet.
Because my children are 26 and older.
Oh,
So I
darn.
can't do it. I
Darn,
know.
darn.
Anyway, it's really cool. I have,
What
Yeah.
a great idea.
isn't it sweet?
Really, very nice.
I
yeah.
know. I really like that
I want to be
about them.
25 again.
Sorry.
Yeah, I wish I were 25 again.
I think we've gone down a bunch of rabbit holes, and I think getting back to the original question of like what is holistic dentistry, I think you can start to see where there's a whole bunch of different modalities and things that you can include in it. And I think that, I mean, things that you guys can think of, frequencies, energy levels, light energy and light treatments. There's a whole bunch of different things that we can use in that moniker of holistic dentistry. So I don't think that there's any, true definitive definition of it, but all these things that Susan's pulling out of her thing
my rabbit hat.
are all parts and pieces of holistic dentistry. So I think that it's, we could go on probably for days and, yes.
So we use this. It's an ultraviolet light for people that are kind of flipped out because they're like type A personalities. If you put it in your ear, it activates your vagus nerve and it moves you into a parasympathetic state.
Oh, I need one of those.
Yeah. So it's also good for like injuries. But I'll just pass this around. You just put it in your ear, hold it for a little bit, and you can.
Is there any difference between the 2 of those
No,
devices?
they're the same.
They're just different colors.
And they're
I don't know why.
And there's
How expensive?
This is like maybe 100, 150.
and there's different lights. I mean, there's red light, yellow light, blue light, and they all do
Just
different
don't
things, and they all can
look
go
at it.
deep or shallow. No, ferritin is not iron levels. Ferritin is an iron
the
carrier.
question.
So ferritin and iron are completely 2 different things. Nobody is anemic. Nobody has too little iron in their bodies. I think that's a myth of traditional medicine. But ferritin is just an iron carrier, so they're two completely separate things. So I think we should be measuring, magnesium, selenium, copper, a lot of other issues, but not iron, because nobody's really
We're doing
deficient.
questions now?
Yeah, I guess we are, but
We're doing questions now.
But I was going to go back to, because we kept going down rabbit holes, and I was thinking that we should, encompass holistic dentistry, but I don't think.
Well, let's do this.
Oh,
I brought a
gosh.
whole
Oh my
bunch.
gosh. I've had people call up on the phone and say, "Are you a holistic dentist?" I'm like, "What do you want?" "Well, I just want my silver fillings taken out." "Well, okay, fine. I'm a holistic dentist." But I think it goes farther than that, and I think that what our point is that as consumers, you're paying for a service. You're paying for a dental service for them to perform on you. And I think you, as consumer, as the one that's actually paying the bill, should demand how you receive treatment. And I think that's our major point, is that whatever we're not saying that you have to go in and be an expert at dental treatments, but you know what you like and you know what you want, and that's where you should be demanding it. I think that's the main point of our talk, is that that's the only way dentistry is going to change, is that the consumer asks and demands for something different than what's been put forth all these years.
Yeah, we just want to empower you to
Totally.
know
Completely.
what you want, but our job is to give you the information. And then we're not trying to tell you what to do. We're just giving you the information, and you have to decide, how does that work for you?
Yeah, exactly. And there's no way that we could sit here and talk about every aspect of holistic dentistry or alternative dentistry, but at least we can give you a few things that are different than traditional dentistry, and then you can decide, like Susan says, what fits for
Sample.
you.
So there is a relationship. So there's energetic information too. I'm actually right now in a course called Dental Decoding. It's very interesting. The whole left side of your teeth those are all female, and the right side is all male, and it talks a lot about ancestral trauma and a whole bunch of stuff. But there is also the tooth meridian chart, which tells you about how the tooth is related to other organs in your body. And sometimes, like, your body would rather take out a tooth than an organ. So sometimes your problem with your tooth, say you have a heart issue and it's actually your wisdom tooth. And if you can discern that by numbing the wisdom tooth, and the heart issue goes away, and you go, oh, okay.
So back in the early 50s, a couple guys got together and they kind of melded Eastern and Western philosophies together and came up with this tooth meridian chart. So if you go to Google and Google tooth meridian chart, you'll come up with this.
Right. This particular chart also includes the emotions, because they're also in there. So I make copies, so you all can take a copy and you can look at it. You're the point person.
This is a great thing to have when you're at a dental office too, because you can say, well, this tooth hurts me. Well, what's on the chart, and how does that affect the rest of my body? And I think as dentists, we were taught that original equipment is the holy grail, that we're not supposed to take out teeth just to take out teeth. Like Susan said, sometimes there can be major issues in somebody's life that the teeth are truly affecting that issue. So it's almost as if we have to take that tooth out to solve that issue of that person's body.
Maybe we'll just get it numb and decide.
Yes, or maybe just get it numb.
You're just
Yes.
trying to diagnose,
Yeah.
really. What we're
Yeah.
trying to do is figure out the puzzle of the human being that's in front of you. And a lot of it has to do with the person and their own history, and you have to kind of do a very thorough conversation. Sometimes people had a dentist that they hated that put something in their mouth, and they're reacting to their hatred of that dentist, so they have an issue and they have to clear that upset, and then the issue goes away. Interesting.
Dental trauma is huge.
It
It
is.
really is huge, and I think that a lot of people. So the question is that is there a type of thing as a holistic oral surgeon? Wow.
Yes.
I guess so. I guess you could say yes.
It just depends on what you mean by that.
Yeah,
It's like,
yeah, exactly.
are you going to take the mercury out? Is it safe? How do you do it? There's like the gold standard.
So
Yeah.
if we were taking, if we were an oral surgeon and we were just taking one tooth out, the tooth roots are held into the bone by ligaments, and so that's soft tissue, and that could get infected. if we leave that ligament in there after we take the tooth out, the bone grows back and heals that hole where the tooth used to be and encapsulates that ligament.
That
So
live
now,
tissue.
yeah, now there's a source of infected soft tissue encapsulated in the bone. Well, that's not good. And so, yes, if you're saying holistic oral surgeon, they're probably going to pay attention to making sure that ligament's taken out. There's so many other things that they.
And they might incorporate ozone, and
Yeah,
they'll incorporate
and-
homeopathics like Traumeel, and they'll incorporate other things in their toolkit than a regular oral surgeon.
In the United States, there's probably 4. So, yeah. She's bringing up the issue of root canals. I don't know, are root canals good or bad, or, what? There's 30 million root canals done in this country every year. So that's a huge, huge amount. It's a huge revenue driver. So basically what happens is the tooth gets infected. So the nerve in the very center of the tooth gets infected with bacteria, and it can't heal itself. So they go in and they take the nerve out. It's about the size of a thread. It's really small. And then they put a rubber-based filling back in that contains barium, which is a heavy metal, so that we can see it on the x-ray. So traditionally, the entire tooth is infected with bacteria, not just the nerve. So they say that teeth have about 50,000 miles of pores, of tubules, of pores in the tooth. It's a lot of pores for the bacteria to hide in. The bacteria can also emanate into the surrounding bone area. Traditional dentistry never addresses all that. So
they deny it. They say that's not possible.
Correct. So
Wrong.
Yes. Well, we could go on for days about the arguments of traditional dentistry and alternative. But so I think if we're going to do a root canal, doing a root canal with ozone makes a lot more sense. But I think we can also probably regenerate nerves and not have to do root canals if we catch it soon enough. So
and that's the domain of exosomes and peptides.
Yeah, well, we can. Yeah, there's probably a lot of stuff we can use. But I think the major question is are root canals good or bad? We're taking out the blood supply, the nutrients, all of that's helping keep that tooth living, and we're replacing it with a
Barium.
a heavy metal and something that cuts off that blood supply. So we're not. It's almost as if we have a dead organ or dead, piece of
Like you have a gangrene
body
body part in your mouth.
No, it can't be good. And it goes back to Susan's point earlier about how teeth affect the rest of the body, is that if there's a root canal, if there's a silver filling, if there's a metal crown, if we think of our bodies as just energy balls, and there's energy loops in the body's circuits, that root canal or that metal filling or that metal crown is going to stop that energy, or it's going to at least be a speed bump for that energy. So it's going to affect the health in that way of the question is I have a mouthful of old dentistry, and how do I start addressing it, and how do I redress it? And obviously going to a traditional dentist, we're just going to kind of repeat the whole scenario all over again for the next 20 years. So yes, that's what we're talking about, and we're trying to give you guys information about what to ask for in terms of an alternative mode of dealing with all of this. So something like that, her question involved that she has a lot of old dentistry in her mouth, and where does she start? How does she start?
And who does she go to?
Yeah, and who does she go to? So I think that's just a matter of interviewing a bunch of dentists and saying, what's your philosophy on treatment, and how do you do it? Does that agree with you in terms of that? So if you were to interview, say, 10 dentists, do you agree with any one of their philosophies of how they would treat? You go in and you say, look, I have a mouthful of silver fillings, I have some root canals, I have missing teeth. How would you address that just on a general scope? And how does that philosophy fit with you as a patient? Obviously, you're not going to change everything tomorrow, and you're going to go through it slowly because you're going to need to detox with each step of the way. And yes, you eat fine, but how's your liver function? How's your kidney function? And all the other things in your body that need to work optimally, but they're not, because you have all these depressed. The dentistry has depressed a lot of those systems. Yes, the amalgam. They did a study in China where the kids that had amalgam fillings were 8 points lower on their IQ scores. So, I mean, we could have been somebody, you know, who knows?
The problem is that we all hear about the controversies and then we get afraid. Oh my God, I've got a root canal. This person says it's bad. I should pull it out. But you shouldn't do anything until you're kind of clear about the whole picture. Because suppose you pull out all your root canals, now you have nothing to nourish yourself.
Yeah,
It's not going to be great to put in implants. You don't have enough bone. You try to do a removable appliance and it doesn't stay. So you get food under it and it's really annoying. So you and you hate that person, and that made it even worse because now you're carrying around that trauma.
Yeah.
So you really have to kind of get the whole picture, and you have to know, okay, can my body tolerate one root canal? Can I tolerate 2 root canals? How do I want to approach it? So you have to be a big participant. There are so many ways to go about dentistry that, like Eric says, you interview people. What is their philosophy? How can they might give you more than one option. And yes, implants is another area of a controversy because there's titanium and zirconia, but there's also metal, which he's talking about. So you are an electromagnetic system, and you have energy flowing through you. I like the way this analogy worked. If you have a lamp and it's plugged in the wall, it has a circuit, and you can turn a light on. If you do a root canal, you unplug it. Now you have a lamp that's not got any energy flowing through it.
That looks good.
It looks good, but it's like a stalled car in the lane. Your energy has to go around it.
But what
Now-
does a titanium post do?
Same thing.
With an implant.
They will do
There
the
you go.
same thing. They will be a stalled car in the lane, and you can't go through it. But they also can create so much circuitry that it really, your brain gets really fried. So here you go.
So
Implants.
like Susan said, there's 2 types of implants. So titanium is a metal, zirconium is not.
It's a
So,
non-conducting metal, but we won't go there.
okay. So titanium is an alloy. It oxidizes in your mouth, so it rusts. Basically, it's got 4% nickel and 6% aluminum. So those are heavy metals also. And like Susan said, it's blocking the energy flow. So yes, we would vote for zirconium if we're going to put implants in. That goes back to your original question: is we're not trying to make you dental experts. We're just trying to give you information that what feels right for you. You know, you're going to have to go back because you have a mouthful of dentistry. You're going to have to go back to somebody who says, okay, let's do it a little at a time. Let's look at the rest of your body. How's the rest of your body reacting to when we remove something and replace it? And so I think that's the big issue, you know, the global picture of everything.
Right. If you ripped out all your mercury fillings, you would crash.
Well, and also, you know, finding the people that actually have this type of philosophy, because, you know, how do you find a holistic
Interview.
dentist?
They're International Academy of Oral Medicine and
You know,
Toxicology.
there's granola organizations, and you can go to find a dentist. But any dentist out there could call themselves a holistic dentist.
Yeah, I want to
Anybody.
say that because for Karen's son, who was in Oregon, he I think it was your son. I looked at the IAOMT website for a holistic dentist, and then I started calling them. And you didn't have the questions to ask, but I did, which is, do you use ozone? Oh, do you do ozone injections? What's that? Yeah, we have ozone.
Bad sign.
Yeah.
If they
And then
say,
you go,
"What's that?"
they don't even know what an ozone injection is. Then I go, next.
Yeah.
And so you kind of, like, they're sort of partially holistic, but they
Right.
don't have the whole picture.
Right.
And that's the part about interviewing them, that you find out what fits for you.
Right.
Right.
International Academy of Oral Medicine and
So
Toxicology.
the 3 dental organizations, the granola ones, are the IAOMT is one, the IABDM is another, and the Holistic Dental Association is another. And
HDA.
and they all have Find a Dentist directories on their website. So the question is, okay, we have a tooth and we don't want to do a root canal, we don't want to take it out, and we don't want to put an implant in. What do we do? So yeah, your choices start to become more limited. If it was something where it was an immediate immediate infection, we might be able to use biologics. We might be able to use stem cell type products to reverse the infection of the nerve and save the tooth. If the tooth came out, there's a hole there, there's an option to just leave it as a hole and just function with the hole, or to put, say, something removable in there, that like a fake tooth that clips in there.
Or a bridge.
So yeah, or exactly. Yeah. The question is about cone beams, and so basically what that is, there's different names for it. There's cone beam, there's CBCT, 3D. So basically, it's a three-dimensional X-ray versus the X-rays that you normally and traditionally have gotten in the dental office are two-dimensional. So with the cone beam or a CBCT, a three-dimensional X-ray, we can see a lot of what's going on in the mouth, the head, by doing virtual cuts. So we can essentially look at it from a vertical angle and a horizontal angle and be able to see what's kind of behind that. So the traditional X-rays that we normally do in the dental office are two-dimensional. So whatever's on the outside is blocking whatever's on the inside. If there's some pathology going on the inside, we're going to miss it because that outside healthy part is blocking it. That's where the cone beam or this three-dimensional X-rays would come in handy. Yeah. So the comment was, how do I delineate what a holistic dentist is, or how do what's my criteria? And I think the comment was right in terms of I think ozone is a window. I think if somebody's practicing dentistry with ozone, I think they have an open mind, and I think that they're open to other avenues, other modalities that are alternative. I think it's just a start. Ozone's great. It's a disinfectant. It reduces the bug population, but it's not the end all be all. And I think, but it opens a door and a window to a lot of other things. A lot of other things that are things. I think traditionally we could have an argument for days about the amalgam, the silver fillings, and root canals. I mean, I think you could go back and forth for days and go down a whole bunch of different rabbit holes. But I like your approach. I think it's great if you start asking questions about their philosophy, and does that work for you and your philosophy? I think that's great.
I think we need to have dental consultants as the next thing that
Top
we.
job.
Yeah,
Gosh.
that there are consultants that you can ask those questions.
How much can I charge?
dental advocates.
And so the question was, if you're missing a tooth, and what can you do besides doing an implant?
Thank you.
If there's adjacent teeth, we could do a bridge, and so that's something where we could permanently cement a 3-tooth piece that would fit over the adjacent teeth and have a false tooth in the middle that will be connected to those two teeth.
And it's permanent. You don't take it in and out.
Like an RPD.
No, that's removable.
Yeah.
So then that would be
Yeah,
That's
that
a
would be a
removable
fake
partial
fake tooth.
it's
denture.
not like an RPD.
Right, exactly. So the other choice would be to have a fake tooth that would have clips on it that would attach to the adjacent teeth that you could take in and out. Yeah, so the comment was that she had a tooth that had a chip off it when she was younger, and the dentist did traditional therapies and just whittled the tooth down to a crown so that made the tooth small so they could fit a crown over it, and did a gold crown in her mouth. So gold is a metal. Yes, it blocks the energy just like any other metal would. It's obviously a little bit more biocompatible than, say, silver is, but
Noble. It's noble.
yeah, it's noble. But it's still metal. It's still going to block that energy flow through there.
Actually, I want to say something about that because I have kept my gold crowns
All right.
from dental school for 35 years. And now there's at least four metals in the gold, which is causing corrosion, which is actually causing my natural teeth to wear without even touching them.
Yeah, and even though it says it's gold, Susan's right, there's a bunch of other ones.
There's a bunch of others, so even that.
And it goes back to, I think that, yes, because that traditional thinking is not, I think we should be saving healthy tooth structure. So I think in your case, if we saved all the healthy tooth structure and took out the part that was broken or filled or whatever was not natural, and then just made a puzzle piece of porcelain to fit in there, that would have been perfect. So the question is oil pulling, and so traditionally we think it goes back to Ayurvedic medicine, but it doesn't really. But so typically coconut and sesame are pretty sticky oils. So essentially the idea is you put the oil in your mouth, you swish it around for few minutes, 20 minutes, whatever, while you're vacuuming the house, and the loose bacteria in your mouth gets incorporated into the oil, and then you spit it out. So you're reducing your bacteria load in the mouth by doing that.
But they also say that it pulls toxins out of your bloodstream because your circulation in your mouth goes around very quickly.
The question was, does it, that all of this stuff that we're talking about, the oxidative therapies, the oil pulling, does it get rid of the good bacteria as well as the bad bacteria? Yes, it gets rid of all the bacteria because they're all bacteria. They all have cell walls. But we know that the good bacteria repopulates faster than the bad. So now we're trying to create a healthier biofilm. We put probiotics in. Now the good outnumber the bad. The question or the comment was, standard of care. What do we consider standard of care? So traditionally, the standard of care is what treatments that research would back up, would verify and actually validify. But it's been bastardized to include, like, what will the, excuse my French, but all the other stupid dentists down the block, what would they do? I mean, if you got 10 dentists down the block and you said, okay, what's the average of what they would do? Super low bar. And so now we've taken the lowest common denominator and called it the standard of care.
And also they have, if you're a member of an organization like the American Dental Association, they have an ethics committee, and if you're a member, they will take you to the ethics committee and they'll review everything you've done. If you're not a member, they don't.
Certainly. Well, yeah, but if you're not a member, then you're judged at a lower standard than if you are a member, because if you're a member, then you can go there and they can tell you you're a really crappy dentist because you're a member.
So just
but if you're
either
not,
don't be a member,
they can't say anything because you're not a member.
Right.
So the question and the comment was about cavitations, and so basically cavitations are what we consider or what we define as an opening that bone.
a pocket of necrotic bone.
Thank you. Anytime we take a tooth out, there's a hole there, and that bone has to fill back into that hole. Sometimes it will encapsulate the remaining bacteria, and that's what we would call a cavitation. So
And you can see them on the three-dimensional x-rays because you can measure the bone density on those x-rays, and you can see, sometimes you visually see them, sometimes you just see that there's no bone there, and you know that that person has a cavitation, also called osteonecrosis.
And that can affect, just like we were talking about earlier, a tooth that is blocking the energy. A cavitation likewise can block energy on that meridian.
So what they do for that, sometimes you stave it off with ozone injections. Generally, you'll go in surgically, you'll find the hole in the bone, and many people that do cavitations can do biopsies, and they'll find bugs, parasites, eggs, and you can see them that are hiding in there, that have been there for however many years.
Her comment was, how do we detox from, well, in particular fluoride and a lot of other dental materials, or just in general, how do we detox? And Tamarin was one where we can detox from the fluoride if our pineal is stuck and calcified. But there's a whole there's a whole host of other ways, and I think I think also homeopaths have to come into the picture too in a holistic practice, and I think you have to have somebody that's a little bit knowledgeable in how they work or what they're using them for. But I think there should be a lot of different. I don't think it should just be one thing, like Susan was saying, ozone, but we don't know how to use it, kind of thing. There should be a whole host of modalities that we can use in different situations. So the comment was about ozone, and yes, ozone will reduce pain or eliminate it. It will heal tissues 3 times faster. So I think anytime you incorporate ozone into dentistry, it's going to help a lot.
And it's got a numbing quality, which is very helpful. So you cut yourself with a knife and it hurts. You can just use ozone.
Don't do that.
Wrap it really tight with the ozone. Don't look at it for a day and a half. Then you take it off. It's like clean, doesn't hurt.
Thank you.
Thanks for joining me in this conversation.